Hey guys, welcome back to another episode of Real Talk with Renisha. Today I have an amazing guest. Have you guys ever wondered what if you were diagnosed or a loved one was diagnosed with cancer? What would you do? Where would you go? Who would you turn to? My guest is a cancer specialist, a tumor specialist, and he is going to tell us everything that we need to do, the different types of cancers, why certain tumors are most accessible than others. Join me on the inside if you're curious about cancer. Yes, the big C word is super scary as he breaks it down for us. I will see you on the inside on Real Talk. See you there. Hey guys, welcome back to Real Talk with Renisha, the podcast that aims to inspire, encourage, and empower you as I speak with real people on their journey. Today I have an amazing guest. He hails all the way from Texas, Dr. Bobby Guillory, and he is a medical healthcare consultant, a biochemist scientist trained in cancer biology. Ladies, this is the show that we've been waiting for. He's a cancer expert. Anything that we need to know about cancer, whether it's breast cancer or other cancers in our bodies, this is the show for it. So I'm going to jump right in. Dr. Guillory, welcome. It's a pleasure having you here.
Thank you so much. Thank you for the invite. I was thrilled when you told me you had this platform. So thank you for working with my schedule and along with your schedule to have me present. Appreciate it greatly.
Absolutely. And I know you are incredibly busy. So just you taking this time out to be here is greatly, greatly appreciated. So I'm going to jump right in with the questions, right? Tell us more about your work and why it's so, so important.
All right. So when we look at trying to help people, what we're really trying to say is we're trying to save lives. And how do we do that? As a cancer biologist, we look at mechanisms or mechanistic approaches to really slow down, pump the brakes on cancer growing, the cells multiplying, leading to metastasis.
Mhm.
So that's the big picture. Typically, if we can keep it localized to one spot, one region, it is much easier to treat and early better than later. Many of our cancers we can treat very well with many approaches if it is diagnosed and caught and treated early.
Mhm.
And so the other part of that is educating patients well enough so that they ask the right question and can interpret some of the changes that are happening with their bodies.
Mhm.
And this could be those under 50, this could be those over 50. This includes males, this includes females.
Mhm.
And so we know that cancer affects children as well as adults. Some of them are the same type of cancers, but some of them are different, and some are more targeted, particularly on the reproductive cancers, to one sex versus the other.
Wow. The big C word, right? We'll talk a little bit more about that even later, but where did this drive and passion come from? What leads one to say, I want to study cancer as opposed to something else in the medical field?
Wow, great question. Great question. So it happened to me in terms of medical at five. At
Okay.
5 years old, I knew I wanted to be in healthcare.
Wow.
Now, in terms of being a doctor, a physician versus a scientist, a physician scientist, or being in one of the therapy specialists, I didn't know really yet until after high school. So
Wow.
after high school, then it really hit in that it would either be cardiovascular or reconstructive. Didn't know which one of those it was going to be. But I went to college and finished at Morehouse College in Atlanta.
Nice.
And I went to one of our seminars for biology majors, healthcare majors.
Mhm.
And one of the doctors had asked this visiting pharmaceutical representative who talked about a drug, how does this drug work on different populations, meaning ethnic groups?
Mhm.
And so the man paused and he says, well, we only tested one group at the time, and that being Caucasian women. So he
Okay.
says, well, how can you stand before us and say that this drug works on all breast cancer
Wow.
when you have not tested? So right after that seminar, I went over to that doctor, Dr. Johnson, and asked him, I said, what did you mean? I said, I thought cancer was just cancer. He said, no. He said, it is very different, meaning the receptors on the cell that actually fuel the cancer growth, whether that's estrogen, progesterone. He says, so those are things that we look at. So he says, if you want to know, come to my lab tomorrow. And that changed the course of my life. That one encounter, that one question, the
Yes.
drive, it came, and it says, I need to know more about this. So that's what started the journey on cancer, which then also you study cancer, you study other diseases, because cancer is typically supposed to be a disease of the aging or aged people, where these normal cells fail to do the safe check and prevent these cells from being formed.
Right.
And so typically, when you look at what cancer is, it is often said that cancer is a wound that doesn't heal. And what we mean by that is that you have these cells that are multiplying and they're changing with each division, and they can consume that organ. But what I mentioned earlier,
Mm-hmm.
that with exams, with people going in for yearly physicals,
Right.
oftentimes we're able to catch these things really early in its infancy and then do what we need to do, whether that's in breast cancer, lumpectomy, or if it's surgery, other aspects, or chemotherapy, if it's a little bit more than that, or radiation. But the early detection. So when you put in, well, what caused the C word, the cancer,
Yes.
there's not a silver bullet, as I tell my patients. There's
Mm.
a number of things. So we talk about history, genetic history, family history. We talk about stresses, and we'll hopefully get into to talk about that and emotional part
Mm.
component in that as
Yes.
well. Then there's diet. Then there's exercise. Then there's vitamins. Um, we and I have to mention that are there any traumas in your life, physical traumas that had happened to you? And then there's
Mm.
also the emotional traumas. So you put all of that together
Wow.
in this environment.
Mm-hmm.
Because as a tumor biologist, we learned that yes, the genes are important, but the environment in which the cell finds itself is most important in driving a lot of these factors in there. So we know that a lot of cancers like acidic environments,
Mm-hmm.
pH low, 3, 4, anywhere down there.
Mm-hmm.
And so we know normal cells love this alkaline pH 7.2, 7.3. They love the higher numbers.
Right.
So, in that part of the component that we tell patients, it's typically a number of things that one have to be addressed in terms of healing and reversing and getting rid of it as well. So, but the silver bullet thing, it doesn't work. And even on the treatment side, there's multiple modalities that will help patients recover, get better in terms of that.
That's interesting because we had this great conversation before we started recording this, and there is just so much that we don't know.
Yeah,
And as soon as we hear the word cancer, like you were saying, people just like shut down and block off. And there's just so much that even as a woman, we don't know. And I mean, I go through like my healthcare routine every year, but still there is so much that I don't know, especially when it comes to cancer. And just you talking about it affects everybody's body differently, depending on, and I'm hearing lifestyle.
yeah,
Depending on your lifestyle, it's going to be, it can affect you differently just based on your lifestyle alone. And like you said, I thought cancer was just cancer. I literally just thought cancer was just cancer. You got this thing, it's growing in your body and it's just cancer. But a person's lifestyle can affect how, it'll take, residence in a person's body and affect
correct.
that's to me is like wow, because that I definitely did not think about it from that particular angle.
Yeah,
Yeah.
and even for younger people,
Hmm.
lifestyle as a younger person,
Right.
that trajectory, depending if working
Hmm.
out again, taking vitamins, you're detoxing your body
Yeah.
along the way, which is again a huge part of that. Whether these are toxins we inhaled, toxins we put on our skin, toxins
Hmm.
we consume by
Yes.
drinking and or eating. And then you have those things, whether they could be pathogens along the way,
Right.
and they multiply in the body and can cause havoc too. So it is a lifestyle thing that I guess if we could go back and start teaching our younger selves, what to
Yes.
watch out for, what to look for in doing it.
Yes.
And this brings up the question, because we talked about
Yes.
earlier, about people's access to healthcare.
Mm-hmm.
Because a number of the patients that have come to me for information, for consulting, what do you think about this?
Mm-hmm.
Many of them have insurance,
Okay.
but not all take advantage of the access that that insurance allows. And what I mean by that, wellness checkup, yearly checkups, visit. Then you have people who don't have insurance, who do go.
Yes. Of
And
course.
those are typically, done by, let's say, a federal program or a state program that allows them to go.
Mm-hmm.
But you have this untapped insurance, and I encourage, men and women to use that well when you find a great primary care, and
Mm-hmm.
if you have some other condition, chronic condition that you're
Mm-hmm.
being treated for, that you follow. Because my theory, and this is just my theory,
Mm-hmm.
one disease or condition begats another.
Interesting. Yes.
Because what that
Mm.
does, the organs talk, the brain,
Right.
lungs, the liver, the kidney, they're all in communication with each other and
Yes.
compensating for one when one is stressed or attacked, things like that. So you put all of that in that realm of
Mm-hmm.
someone not getting to the doctor on time. That can delay your treatment. That can ultimately, on the far end, end your life because one was not seeking medical care. And another rule that I have to this is just my rule.
Mm-hmm.
The body typically gives you signs.
Yeah.
It
Oh,
gives
yes.
you and cues.
Absolutely. What I find and what I see most often, even like within my own community, is that by the time the body gives you the signs and now you go get that checkup, or you feeling that pain, and now you go
Yes.
get that checkup, it's too late. Because I literally just lost a relative a couple of weeks ago, a couple of weeks ago, maybe a month ago, from was it prostate cancer? It was ovarian cancer. And this is a woman who I've known to be healthy and strong, Caribbean woman. And by the time she started feeling the aches and pains and started to see that her stomach was bloating and stuff like that, and went to seek help, it was already too late. It was already
Yeah.
too late at that point, but they don't necessarily do wellness checks. And I find that in America, we don't really stress preventive care. When you start feeling pain, go to the doctor, not do the wellness check every year, your annual every year. And, that way you can catch something way before it's time, as opposed to, oh my God, my stomach hurts, let me go to the doctor. And now it's something else that's probably far gone by the time I'm getting those symptoms. So that's what I find that I'm seeing more as I get older as well. I'm seeing that more because I'm in a age group where it's like, okay, I gotta make sure I'm doing my health checks yearly.
Yeah. I'm sorry to hear, about your family member,
Thank
uh,
you. Yeah.
because that is one of those that's on the preventable list, and treatable if caught early. So
Yes.
cervical, same thing, breast, same thing.
Yes. Yeah.
Um, they are prevent colon if they are caught early. And so you mentioned correctly, when the pain threshold is elevated, when one cannot breathe, if
Hmm.
they're bleeding, we're
Hmm.
going to get there, to a doctor. And
Correct.
oftentimes, those are the advanced cases of many of the diseases or chronic conditions that happen. And so, and both for men and women. So, what I said earlier, indicators, things that are not normal,
Hmm.
bloatiness, pain, consistent, growth, um, rash area, tender area, uh,
Hmm.
vision issue, loose stool, difference
Mm,
in urine color, urine smell, urine output. All of those things together could
mhm.
say, okay, something is changing. But
Right.
oftentimes, we, men and women, but particularly I give this to our women, our providers, because they say if you want to measure a family's health, look at the mother.
Yes.
Mom is healthy, kids are typically healthy to the rest of the family. But that is one of the part that you say has to be
Mhm.
addressed really, really early, as soon as we can. on those things.
Mhm.
Again, the wellness checks, absolutely. But if something is going amok, that's different. That's when you raise the flag and you go. One of the things I want to mention in this part of it, with
Mhm.
because you mentioned your cousin, family member, I'm sorry,
Yes, it's okay.
is that
Mhm.
we have to be our own advocates.
Correct.
We're looking for people to come in and save us and make the day right. But we
Mhm.
have to ask and push the question, sometimes from our clinical team when we're not getting it. And what do I
Mhm.
mean by that? I'm still having the pain. Oh, the x ray didn't show nothing. Okay, well, let me see another clinician that
Mhm.
may be a little bit more familiar with this because this is new, this is not normal. And so I need to have this addressed because it is affecting my quality of life.
Correct.
So that part of pushing it, if a doctor, oh, well, we did an x-ray, we did this, but no, you still see I'm swollen on this side, it didn't go away. So there is something there.
Mhm.
So that's where the advocacy for ourselves, but if we need to be that for others, then
Yes.
one should do that and say, well, no, I'll be there. I'll ask the questions. I'll write everything down. I'll be with you for the follow-up. So those kind of things go together.
Correct. I was going to ask, but my next question talked about, when someone hears that they're diagnosed with cancer, it's usually bad news, right? And I was going to ask, how do you and your team have that conversation with those patients? But even when you just said having someone with you, having that patient, having an advocate with them is also a great way. But you can also answer that question as well from your side. How do you guys manage to, tell that news to that particular patient?
Okay, so it can present itself in different ways, but the
Okay.
most common is that the patient identifies something that's
Okay.
different.
Mm-hmm.
Okay, haven't been able to go to the bathroom. There's blood in my urine.
Mm-hmm.
I feel a lump here. I feel bloated in the GI area all over, or I'm having this constant chronic pain that is getting more increase on a 1 to 10. It started as a 3, now it's at a 7.
Mm-hmm.
So those combinations of things will bring people in for testing
Mm-hmm.
at hospital or clinic. So when the doctor, and they'll typically, and they have seen it done two ways, where the physician has called the patient to deliver the news or they've had them come in.
Okay.
So if it's a one where you're being called in,
Hmm.
which means that appointment had to be set, if you can,
Mm-hmm.
bring someone that you trust with you.
Yes.
Um, by that, I mean someone that is supportive, caring, and loving. That
Yes.
can be your extra set of eyes, extra set of ears, recording, writing, asking questions. Because as I mentioned earlier, about 50% of the patients that I've consulted with,
Mm-hmm.
that has happened where they had just completely blanked out on what the physician was saying in terms of the stage, the grade, where it is, what we believe would be the first line of therapy for it.
Mm-hmm.
So that second person will be there and do it.
Mm-hmm.
So it can be accomplished in many ways. Phone call, they will tip, and they've done that as well,
Mm-hmm.
delivered the information, but there typically is an office visit sometimes set after that point.
Okay.
And so where I come in on my consulting part is that I help them understand what it is the clinician, what the pathology is saying, and what it's not saying. So
Mm-hmm.
what are these markers that they say were positive for this, negative for this, positive for this? Okay, I help them understand that stage grade, where it is. Okay, how common it is. What are the common treatments? They're talking about surgery first, then radiation uh, or chemo.
Mm-hmm.
So I help them understand that language, uh, the phases of it, when it should occur. And then we also talk about some genetic testing if it hadn't already been done.
Okay.
Again, going over family history,
Mm-hmm.
trying to see when mom or dad or brother had it, plus or minus 10 years for that the other individual. So
Mm-hmm.
we go through that. And if they need me to be there, of course, at the hospital when they go for that consultation, I've done that as well. So, but
Wow.
having that person there, that advocacy team to help you understand what your options are and what the proposed treatments are. But I also, at this point, would also ask patients that have the luxury and the capability and the time is
Mm-hmm.
to get a second opinion.
Why is
And
that?
what,
Why is that so important to get a
great
second
question.
opinion?
So that second opinion confirms what was found in the first one,
Mm-hmm.
meaning that this is what we found. Yes, it is of this aggression. If it's a cancer, a more aggressive form, or if it's metastasized, we found it in these locations as the second. But we would also treat it the same way. But if
Okay.
you hear one that's saying 30% versus 80%, then that's saying, okay, we need a third one at that time because we have one that's kind of saying low, but one that's saying very high in terms of percent of organ consumed. So you want to do it for those reasons, but you want to hear the same language. Yes, this is what you have. This is how we would treat it. This is the protocol that we would use. So you want to hear that. But if you're hearing something different, but then that's when you would question your clinical team. Well, why would you use this combination of drug or choice of drug or frequency or route? Because sometimes you can get drugs IV versus a pill that you're taking. So you want to know all of that. And they use age, health, stage of the cancer to kind of put that in to a nice formula that would be best for the benefit of the patient.
Mm, interesting, very nice. You mentioned stress as being one of the factors when it comes to cancer. Tell us a little bit about how, because we I know that there's this common terminology, stress skills, and we say it all the time because we know that it does. But can you tell us a little bit how stress works when it comes to cancer?
Yeah. So I like to talk about how it creeps in your life, first of all.
Okay, sure.
But
Hmm.
I think that will help us understand. So
Okay.
it can come in through a relationship that's not going right,
Hmm.
job stress,
Yes.
whether that's pay, promotion, your method or route of getting there and or back.
Hmm.
If there are children, if there's a family member or special needs
Hmm.
child in the family, let's see. Oh, if there's economic strain on the family, so it can come in. Best friend pulled away. They, busy, married, or have other issues. It
Hmm.
can come in all of that little package way then to affect your health. The main thing that it does is suppress your immune system.
Hmm.
So I kind of look at it and explain to patients that you have a couple of fires, things cooking on the stove,
Hmm.
and the immune system is keeping them all going. But this assault, this emotional stress thing that came in, that just really threw you for a loop. So now your immune system is trying to address this issue, and these other things that it was keeping covered and
Right.
quiet are now increasing. So you have that in there, and you have one chronic, let's just say diabetes and or hypertension that come in.
Hmm.
So then the stresses of not being able to put the right diet, right foods, right choices, right exercise in there, or even monitoring it well, whether we're checking our blood sugar, we've modified our diet to some point, or we're still seeing our physician.
Hmm.
So all of those things in there could be levels of stress that come in that could exacerbate the condition or
Mm.
disease. So then how do we put the brakes and
Right.
slow this stuff down so that we know what's going on? So that person has to then grab a hold of the steering wheel for that. And sometimes it's a change of medication, but we mainly have to get rid of what the stresses are and or toxins because the toxins, as I say, could be people, emotions, and sometimes we're our own toxic enemy ourselves and not someone else. So identifying what those things are in your life and then addressing those with the appropriate help that is needed. Uh, Again, simple counseling at some point if that's needed, or coaching, change of
Yes.
diet, change of location, different perspective. But on the health side, having a clinician follow you with that to see how we can help you be more compliant if it's a compliant issue that's
Mhm.
driving that, preventing you from monitoring and checking, or get you help with the special needs child and or family member or aging parent that's needed. So a number of things that could be done, but first have to be identified. But stress can kill when it goes unaddressed.
Awesome. I'm glad you mentioned in the end right there about taking care of a family member and even a special needs child, because sometimes people don't see those things as being stressful, but we know there's like this whole talk right now about caretaker fatigue and caretaker, feeling stressed out and burnt out. And it's such a real thing. So I'm glad you mentioned that. But just the thought of stress, and you said the ultimate goal would be to get rid of the stress. And
Right.
even as
Right.
my work as a therapist, it is so hard to get rid of the stress in a mental capacity, much as for a physical capacity. I can see it even being even harder. But that is the key because unless you get rid of that stress, if it continues to linger, nothing is really going to change that much. It
Right.
has to lessen enough to make a change. And I think that's what's very hard for a lot of people. It's getting rid of stress
Yeah.
in this
And there's
world that we
help.
live in. Yeah.
Yeah, there's help for people to identify both of those, and coaching and counseling,
Correct.
and if medication is needed, to be able to help with some of that in there, because right, a lot of people don't have the tools. If they
Correct.
did the knowledge, they could fix it all. So, but back to the stress with the parents taking, I've witnessed that in the hospital setting,
Yes.
when you have the special needs, and one parent is typically there. Sometimes both parents could be there, but most of the time it is one parent, and oftentimes that is the mother
Yes.
that is there. But I have seen fathers there as well, or the tag team in some cases. But that can be a lot on it. And in terms of the adult situation, I help take care of my mom. So
Yeah.
if someone didn't show up, I had to miss work and be there to do it. I had to help train these new people that came in, to help along the way to do it as best as they could, because of
Right.
course no one can do it the way that you do it yourself, but
Mhm.
you can help get them as close to that. So
Right.
there's a lot, in that. And when I would ask people now, um, my phrase to them is how you doing, and not what you're doing.
Yes. I like that.
And it's positive for both things. A lot are not doing what they said they wanted to do or what they used to do, if that was really good. And so you eliminate putting them in that position.
Mm.
But the how you doing, we can help you with addressing that, because the eyes don't lie. They tell the truth. And if you're watching the eyes, you're watching the behavior, you will see the answer that comes back to you, if that is with peace and truth.
Mhm.
And if not, if that opportunity um, can't happen there, if you're in public setting, then a private setting, to be able to offer assistance and help if that's needed. But that tends to help when you look at the eyes and see that situation. Oh, it's
Mhm.
not. Let me address it later if you're in a crowd. But
Right.
go ahead.
That's interesting. No, that's very interesting as you put it. Hmm. There is help. I feel like in every aspect, like you said, there's help. There's help, but is also people realizing and recognizing their need for help instead of letting pride and stuff like those types of things come in. Because I mean, I have clients who would benefit greatly from, let's say, an anti-anxiety medication, and they're like, no, I don't want to take that. I'm not going to do that. That's not what I want to do, and they can benefit from it. So it's really about knowing the education, of course, and wanting to accept help. Because everything doesn't look like a quote unquote, I always say, well, if your doctor told you you need to take a pill every day for a heart condition, would you not take it? And everyone says, yes, of course I will.
Hmm. Hmm.
Okay. So if you need something to just take the edge off and help you not be as anxious, why is that such a, talking about, totally two different stigmas here, but nevertheless, people not, taking that help sometimes, or even identifying the help or accepting it. And that's to me the hardest part, because there is help for every single condition pretty much that we can think about here in America. And still, so many people are suffering.
Well, that brings on two questions.
Hmm.
So the first part of it is the stigma for mental health.
Yes. Yes.
So just to give you a quick example,
Hmm.
when I was working with breast cancer and a group of women for domestic violence, they would address and answer all your questions about breast cancer: where
Yes.
they were, how they found it, whether it was mastectomy, lumpectomy, but they wouldn't talk about the domestic violence,
Interesting.
stigma associated with that. So back to America part, if we're talking about rural versus urban areas in
Yes.
the United States, there are very few, clinicians in certain rural areas. So people have to travel a long distance to get
Yes.
help. So some of that not getting help, okay, well, I need someone to watch the kids, or the parent, or the special needs kid, so that I could
Right.
go. And so that can bring. So we have a lot of things that's happening, and one of the things that I think is happening in the news to address that part of it is
Mhm.
that we have a lot of physicians from international countries,
Correct.
and oftentimes here in the States, it's not recognized a residency program. So that may be changing to help in some of these rural areas to get clinicians where they're needed to help with that, getting the help.
Hmm.
Because, right, as you said, with the pill for the heart, oh, yeah, everyone wants their heart to keep pumping.
Absolutely.
But if I said that I have anxiety and if it gets out to my insurance company, if it gets out to my job, then will I still have the job or be ready for that promotion? So there are some stigmas that it's getting better. It's
Yes, it
not where we
is.
need to be because people are talking about, and men and women are
Yes.
getting counseling, getting help for that. But there are much more that need to seek help for that at different times in our lives.
Hmm.
So that's where some didn't need it earlier, but they need it when they're older. And the reverse of that is true. So I'm hoping that we're getting there because of platforms like this
Hmm.
that are letting people know that there are agencies out there coaching counseling
Hmm.
that could be done from their home. They don't have to come in to do it. So it can
Exactly.
be nice and private there, but to let people know that there are resources. But I think on the outside, the medical group, the counselor, we have to do a better job of advertising that we're here and what we specialize in order to help them, because that's huge too. Oh, well, I didn't know it dealt that. I just heard breast cancer, but that had nothing to do with cervical cancer, liver or renal cancer right there. So some of that is kind of drowned in that. But
Mm.
again, there is help.
Absolutely. Great. Let's do a little switcheroo a little bit. Let's talk about men's health a little bit. So,
Okay.
as a woman, like I said, I do my annual test for everything, right? And I am a sister to three brothers. And I know not one of these brothers of mine, all three of them are doing annual checkups and at various ages. Tell us a little bit more about men's health and when it comes to cancer prevention and that type of stuff.
Okay. So this goes back to that question. I'm assuming they have insurance. I'm
Yes,
sure they have access. They can physically get to the doctor.
absolutely.
There's no language barrier there, so they can ask, okay, then we need to get them there. I need you to set their appointment. But yeah, that's a huge problem that we've been having with men and men's health, particularly for the reason, oh, I feel fine or I don't need to go. But those same clues, signs, and cues that I mentioned women have,
Hmm.
men get those too.
Hmm.
And oftentimes, in the case, let's just talk about prostate cancer.
Hmm.
Uh, it is on the advanced stage when men go in,
Ooh.
uh, and that is horrible because this is absolutely one of the treatable ones if caught early. A good patient of mine, and I say that because he's a friend as well, called me right away. He just went in for his annual, had a blood test, and said, "Hey, my levels are like this. What do you think?" And I said, well, they are a little bit elevated for a person your age, number one. And I said, two, did they schedule any imaging? And he said, yes, they did. So after the imaging was done, then they did the biopsy. And so for those that don't know, the biopsy is the part where they actually go in and pull some of the tissue out and put it under a microscope process. And that really tells you definitive that you have cancer or if it's something else. And so it was cancer. And it was an aggressive cancer. What I mean by that,
Hmm.
it was one that was dividing quickly, still localized in the prostate. But he was one that did not want to put it off. So he says, okay, please explain to me what all of this is. You know,
Mhm.
they did these tests and gave me this long report, told me how they did it and what it is. And um, now I have a meeting to find out what we're going to do about it. And so that meeting came up that we should do surgery. And so, based on his pathology report and everything that I read, I concurred with that. And the reason that I say that is because when you're dealing with although small but aggressive, within a couple of months, really sometimes even a year, that thing could change and go anywhere. Prostate cancer is one of those that like to go brain, bones, lungs when it leaves the prostate. And one of the things that happens when that is happening, getting to a certain point, There is urine restriction, so sometimes it's difficult for men to use the restroom when that happens because the prostate wraps around the urethra. So when it starts to grow in cancer, it presses on that limiting. But when it's invading at that point, sometimes you start seeing urine in there. And a lot of times men come at that point,
Mhm.
which we know is advanced. So are we losing a lot of people for that reason? Absolutely. Particularly men of color? Absolutely. Because of that reason. The not the missing the diagnosing, the missing going for their wellness check and screenings like that. And that's a simple blood test that they do, for that. And so, yes, there's an uncomfortable part sometimes called the DRE, which is a digital rectal exam.
Mhm.
And that's where the physician puts their finger in the rectum part.
Mhm.
But you can feel the edges of prostate cancer because it is typically jagged and rough. So they're doing that. But the biopsy is the definitive way to confirm what one has in terms of that tissue. But I often say if you have a first degree relative, a father, a brother, you want to do that screening a lot earlier than 40. Um, because typically sometimes black men have higher levels of testosterone,
Mhm.
which oftentimes for the androgen dependent, which means the fuel that's fueling that cancer to grow is testosterone.
Mhm.
So that can happen. There is an androgen independent form as well that it doesn't use testosterone to grow. So many of the drugs are based on what's causing the cancer to grow, and they typically try to shut it off or block it from that perspective. But yes, and many of the women are the one that actually get the husbands, brothers, and fathers in the hospital. So continue doing that, ladies. We need you to do that.
I think I have a job to do myself
Please,
with
please
my
do
three
that. Yes,
brothers.
yes.
So is 40 the typical age for prostate cancer for men? Typically, of
Yeah,
course.
that's well, it can start early, but I
Okay.
think for most insurance, they pay for the screening and everything around that time. But I first degree relative, they will typically bend the rules a little bit for you to do it earlier. And even if they don't, it is worth having that test done to see if it runs in the family. And all the other stresses, the alcohol, the lack of working out, the lack of vitamins that
Yes.
are doing it, the smoking, all of that attributes to that. And again, if there's another comorbidity, you got hypertension on top of that. So remember, I said one begats another. So you want
Absolutely.
to look at all of those things in there. And it's not to say that, and I tell patients this, um, it is the habitual things
Mhm.
that typically saves a person or causes them to get ill.
Mhm.
It's not the isolated incident. It's not the one cigarette a month that's doing it, the one drink like that. It's when you put the back to back stuff, whatever the habit is. That's what typically saves you. That's what typically brings harm to you in that case.
So we're talking about a lifestyle change.
Yes.
And that's for like most diseases, you know, a lifestyle change. It's not like you said, it's not the one cigarette you do once a week or once a month. It's the 3 packs a day.
Yeah.
It's the excessive drinking, it's the excessive any and everything.
Correct.
This is what's causing this stuff. And again, we can change our lifestyle, but habits, as a therapist, habits are hard to break. So
They are.
yeah,
They are.
here we go. Habits are hard to break. So we,
Even with a good reason, sometimes they're very hard to break, and you're like, well, dog, I thought I could master that. But it's the challenge part that if it's something that you need to change, you want to be here happy and healthy. If changing that or do it, we all know that one or two people who
Mhm,
smoke 3 packs every day, drank
mhm,
every day, never went to the doctor, lived to be
mhm.
100.
Absolutely.
But how many can do that is what the question is, and make it to 100 healthy. So that's what tells us when they're, and we all do. I know people that did that, but
Mhm.
the majority of them that did it did not make it there. So happy and healthy and with that longevity on there, whether they were male or female.
Correct.
That part of it in there has to be, addressed as we go with the lifestyle changes and from young to old because
Correct.
it follows you. Habits follow you as well.
I like the fact that we're talking not just about a certain age group, but typically from young adults, because these
Hmm.
things starts, like I said, in that age group. That's where habit starts. Sometimes a teenager, that's where habit starts. So we're talking about if we can break habits even from that early in our life and start taking care of ourselves at that level. I mean, 40 years later, you should be
Yes.
okay, which is like mind-boggling, right? You could start at 20 and at 40 still be fine and very healthy because you've had a particular lifestyle for these 2 decades, you know? So it's very interesting.
Very true. Very true.
Yes.
And we have AI to help with this as well.
Mm-hmm.
When we're screening medical records and putting together things that it would take a lot of time to go through a file. Okay, when did they develop this? When was the rash? When was the fever?
Mm.
But AI is really helping with navigating people and even clinicians
Mm-hmm.
to more streamlined time point diagnosis with that because it's there. And so therefore we can go back and look to see when this really started, you know, during those early years, those later years, and how that all meant with the either healthy lifestyle or not. You know, did it slow it down? Did it help it in some way, exacerbate, grow, spread? But those are the things that I'm hoping the AI part of all of this, even with coaching and counseling,
Mm-hmm.
will help us get there if used right.
Interesting. So AI is now part of our world. So absolutely. I was going to ask, how is it impacting what you're doing? But we're talking about that, even that question. So yes, absolutely. Is there to help?
Yeah.
Absolutely. Use it as much as you can because it's there to help us. But again, it's good to talk about, starting from that age group, that and just hopefully be able to have that path where that age group, even in their 20s, and even before they, if necessary, can, start living a healthy lifestyle. I feel like the way that our food is chemically made these days and the pollution, and it's even harder. It's even harder to maintain a healthier lifestyle, from our generation, when things were really and truly organic. Now I feel
Yeah.
like, oh, is it really organic? Sure it is. I'm a Caribbean girl. So we grew our vegetables and we grew our stuff that we ate. And in America, we don't necessarily do that as much. So what are we eating? So it's even harder now to even have a healthier lifestyle because the food that we have in this country is not 100% on the up and up compared to the rest of the world.
No, it can't. And I love the way certain communities are doing that. You're
Mm-hmm.
absolutely right in terms of our Caribbean communities do
Yeah.
a wonderful job, with growing their own food, self-sufficient in terms of that. And then some are able to still do it here in certain regions of the United States. But it
Correct.
is more difficult in the bigger cities, to have the land, have the space, have the animals to do it. But the expense sometimes, when you find it, you can do it, but it is expensive
Mm.
for people to do it. But you would think that if it could turn around and be the fast food place, accessible, affordable, on every corner, how much better this world would be with the right foods, move the sugars and the dyes and
Oh.
all of the stuff that keeps the brain jumping, allows for healthy skin, healthy hair, um, all of that. My grandmother and my mother always said it takes one person to make a difference.
Mm. Love that.
That one idea, that one gift,
Mm-hmm.
that one thing that you're able to
Mm-hmm.
bring
Mm-hmm.
that you have that no one else has, or that you do it differently and better.
Yes.
That is what this is about when you said, I have this platform of introducing and explaining to
Mm.
people their gift, that part of it to help people live better and do better and make better choices,
Mhm.
um, understand what's happening, be real with it, and then seek out and find that help in all of those areas.
Mhm.
So I want to thank you for doing this. As I'm listening to you ask these questions, I'm like, you're hitting at, how can people see that and say, oh, you know what? It may not be for me, but it is for someone I know. So I tell people I like to
Absolutely.
vote. When I
Yes.
vote, I vote for those above my generation, and below my generation.
Yes.
Because we love people, most of us, in each of these groups.
Hmm.
And
Yes.
so, therefore, you're looking at not just you and your taxes and your money, whatever,
Mhm.
but you're looking at what's happening to the one generation before you and the one that's coming after you in terms of that.
Mm.
So that's why these platforms just say, okay, well, I have everything together, but we know somebody who doesn't, and maybe this information will help them at some point. So thank you for having this platform
Oh my
for people
gosh.
like myself to be able to help in any way that we can.
Oh my gosh, thank you. I am learning so much, and I learn from all of my guests because everybody's bringing something different to the table. And this whole cancer talk, I love it because the more I know, knowledge is power. So the more I know is the more I'm able to better advocate for myself as well. So I'm loving
Correct.
this. I'm loving this as well. So thank you as well. Hey guys, so as you can see, we are having this amazing conversation. We are definitely going to have to break this into two parts. So I just want to thank you for tuning in thus far. Thank you for watching. And I am going to see you in part two of Real Talk with Renisha with Dr. Bobby. I'll see you there. Thank you again and have an amazing day.